Prime Minister there. Well, Dr. Charles Alessi is the chair of the National Association of Primary Care. As you see, he joins me now. Very good morning to you, Dr. Alessi.
Morning.
I mean, a lot of people, nearly everyone's got to say, well, this sounds like a good idea. Can it actually happen, though?
I think it can happen, and I think primary care is really excited by this opportunity because primary care at the moment has been reaching out to rethink its offering to patients and to populations. And this is an opportunity for primary care and for general practice to think differently about the way it connects with people, because we've been based on an office-based system for too many years now. We have to be thinking of different ways to connect. Connecting using Skype, connecting using different secure methods of communication will make such a difference to people's lives.
I mean, that's part of what, yes, the Prime Minister's been suggesting. But just on the opening hours element of it, won't it require extra resources?
Not necessarily if we do things differently. And I think the new world of healthcare is not about doing more of the same, but doing things differently. There's lots we do which we don't need to do anymore. A lot of the long-term condition work we do at the moment, which takes up more than half the time that we spend in our surgeries, could really be managed by other people, by pharmacists, by other members of the primary care team. This is an opportunity. There is real appetite for this within the service. And I think it's great because it's voluntary, which is really important, because it gives us an opportunity to think again about the systems that we have at the moment, which aren't working as well as they could be. And because at last it really starts us thinking about the whole person, because that's really what we should be
I mean,
doing.
I just want to stay with the resources, though, because if you're talking 7 days a week, 12 hours a day opening, doesn't that require more resources in terms of more GPs, more doctors?
As long as the GP keeps on doing exactly what he's doing now, the answer is yes.
Okay.
But clearly, that is not necessarily the case, and that is not necessarily what people wish, or what GPs wish either.
What they want to get on with doctoring. So, I mean, is it the case of too much admin, too much being loaded on to doctors over the last decade or so, in terms of they're effectively running small businesses, some of them?
I think they are running small businesses, yes, but it's not only about what they're doing, it's the way they're doing it as well, because it's lots of little things that they have to fill in. And there are better ways we can do this. And this is the opportunity for us to really disrupt the system. But it's part of something far bigger. It's rethinking around our offering around out-of-hospital care, because the future of healthcare is out of hospitals. We need to think again about how best to offer that to our people.
I mean, out of hospitals, but the Prime Minister also saying some of it could actually be near hospitals, in this idea that people are going to A&E departments who really should be going to see GPs. Well, if you can't change that habit, couldn't you put some GPs quite close to the A&E department and say, actually, it's over there you need to go for your sprained wrist?
Yes, you can. And I think the new world is about integrated care. This isn't about primary care as against secondary care. It's about us all working for a common aim. Unfortunately, the money's run out. And I'm really pleased it has, because that's forced us to rethink what we're doing.
OK, very interesting take on that. Dr. Alessi, thank you very much indeed. That's Charles Alessi there, Chair of the National Association of Primary Care.